Hey, Colin Hung here with Swaay.Health. I am here in Atlanta for the Swaay.Health Live 2024 event. This is the first time we're hosting this event under the Swaay.Health banner. Previously, this event was called the HitMate Conference. For those of you that know and love the HitMate Conference, this is the evolution of it. And I gotta tell you, it has been a fantastic event, beyond what I had hoped even as one of the organizers. So first of all, this has been an amazing blend of all the different types of marketers from all across this lovely healthcare ecosystem that we have. We have marketers from health IT companies, we have marketers who work at agencies, and we have marketers who work at provider organizations. And you would think that these three groups do not have a lot in common, but I can tell you here at this conference, they do. We've had some amazing discussions at unconference sessions. We've had amazing discussions at some of the debates that we've run, just around how we're all struggling with the same things around SEO, how we're struggling with the same things about how to manage upwards, how to manage the expectations of the CFO and the CEO and trying to get more budget. So it has been really, really fun and interesting to see these disparate groups of marketers get together here and really compare notes and share knowledge. And that has just been fantastic. I think what's really struck me about this year's event over last year's events, first of all, is the size. This is our largest event ever, which has been just amazing to see. And also the quality of the speakers and the quality of the discussions has just been super high. We've had some very deep discussions around influencer marketing. We've had some very deep discussions around privacy and security and how that relates to healthcare marketing. We've even had a great session that was doing a debate on whether generative AI should or shouldn't be used to create content for both providers as well as for health IT companies. And that is one thing I definitely think that we're going to have as a return. The feedback from the event so far has been that the alternate formats, moving away from the lectures and moving away from just the panels into doing more things like workshops, the Ask Me Anythings, and the debates have been really, really positively received. Honestly, I didn't know whether the debate format would work. And this is very much what you're thinking in your head. It's very much like a high school debate. It was a lot of fun. People really got into character to argue their point, either for or against the statement. And people just had a great time with it, both in the audience and for those actually being the debaters. So we're definitely going to make a return of that next year. If I had to pick one theme from this year's event, so far I think it would have to be that marketers in healthcare are being put under tremendous pressure to justify their existence. And I don't mean that in a negative sense. I mean that people are really genuinely curious to know what the return on investment that marketing is bringing to their organizations. And all the marketing leaders that we've spoken to here are really having to bring their A game in terms of metrics, attribution, and all those things. That has been, for me, the most surprising topic of discussion. And probably actually the most commiserate. We're all commiserating here and all on the fact that we have to do this. And I think it's smart because look, for a long time, marketing was sort of happening. Just sort of something that happens in the back room. And we used language like CTA and cost per click and cost per lead and all these kinds of terms, which frankly, no one outside of marketing really understood. And so, but we were able to get away with that when times were good. But now that times are tougher, marketing budgets are being cut, we're having to justify and really translate what do those mean for the actual organization. Does this translate into more patients coming through the door? Does it translate into more leads coming through the door? And that was a big topic of discussion. And I think a lot of people worried about it, but I think that also represents an opportunity to write our own story. So, if you weren't able to come to Swaay.Health here live in Atlanta, we hope that you'll join us next year. We're going to be releasing where that is going to be in the months to come. In the meantime, we're going to have a lot of content that we've generated from here, posting a lot of articles and recaps. So check that out at Swaay.Health. That's Swaay.Health with 2 A's, with the dot in the middle. That's where you'll find more great content like this. Thanks for being here. I'm Colin Hung, and I'll catch you on the next episode.